Okay. Mandible? Mental foramen? Mandibular foramen? Okay. Incisors?
I have a terrible ankle.
Sorry. Come. Incisors? Canine? Premolars, molars. I'm not going to ask. Incisors is what you should know. Okay. This is angle. Coronoid process. Condyloid process. Fetal skull. Frontal fontanelle. Frontal fontanelle. Okay? Just to remind you, sagittal suture, coronal suture, lambdoid suture, squamous suture. Okay? Frontal bone, parietal bones, occipital bone, temporal bone. Orbits. Okay? And then it gets too small to do. Oh, and foramen magnum. Frontal bone, coronal suture, sagittal suture, parietal bones, lambdoid suture, occipital bone. Of course, it goes way underneath there. On here on the top. Frontal bone, cristagalli, cristagalli, cribriform plate, lesser wing of sphenoid, greater wing of sphenoid, sella turcica. I'll do this on this side first. LOS. Foramen lacerum, foramen ovalis, foramen spinosum, foramen rotundum. Okay, I'll do this one here. LOSR. Foramen lacerum, foramen ovale, foramen spinosum, foramen rotundum. LOSR. Foramen lacerum, foramen ovale, foramen spinosum, foramen rotundum. Foramen magnum. Hypoglossal foramen. See? Down here. Hypoglossal foramen. Right there. It's right next to the occipital condyles, right around the foramen magnum. Occipital condyles, hypoglossal foramen. Okay. Is there anything else on here? No. This big one here is a jugular foramen for the jugular vein, and then it comes through here. But I'm going to show it to you on this side. Okay? So on this one, there's only one really big one, that's the jugular foramen. This one here, this little one right here, is the internal acoustic meatus, also known as internal auditory meatus. So I would put my finger here, and then it comes out through here, through the ear hole, and that's the external auditory meatus or external acoustic meatus, so it matches up like that. Okay? So internal auditory meatus, jugular. Internal auditory meatus, jugular foramen. Okay, we go on this side. Foramen magnum, hypoglossal foramen. Jugular foramen, styloid process, stylomastoid foramen, mastoid process, mastoid foramen. External auditory meatus, mandibular fossa. I'm going to do it over here again, in this angle. Okay, so jugular foramen, hypoglossal foramen, occipital condyle, foramen magnum. Okay, so this is jugular. Carotid foramen. So jugular, carotid. Jugular is in the back. Think BJs. So think back is the jugular. The front is carotid foramen. This fang is styloid process. Here's the mastoid process, and between the two is the stylomastoid foramen. Slide down the mastoid, the mountain and the back, and there is the mastoid foramen. If I come back here, here's the ear hole, And right next to the ear hole, or just in front of it, is the mandibular fossa. That's okay. See?
Thanks.
Okay? So you can see where the condyloid process of the mandible fits into the mandibular fossa, just in front of the ear hole, the external auditory meatus. This is the vomer. This is one pterygoid process, P-T-E-R-Y-G-O-I-D, pterygoid process, right? Lateral plate of the pterygoid process, medial plate of the pterygoid process, and vomer. Medial plate of the pterygoid process, lateral plate of the pterygoid process. Right here, this is the greater palatine foramen, and this section right here is the palatine bone. This is the maxilla, and the little bumps are called palatine processes. And right here is the incisive foramen. In the front, frontal bone, maxilla, vomer, perpendicular plate of ethmoid. Perpendicular plate of ethmoid. Inside, you have the inferior nasal conchae, middle nasal conchae, and then the superior you can't see, unless you go to the book. But I won't give that to you. Nasal bones, lacrimal bones. How do you know? Because there's a hole there. That's the lacrimal foramen. Lacrimal foramen. Then you stick your fingers in there. That is right there. This is the ethmoid bone right here. Ethmoid bone. This is the zygomatic bone. This is the sphenoid bone here. Sphenoid, and it's also in the lateral part of the orbit. So this is the sphenoid right here. This is the ethmoid right here. Lacrimal foramen. Oh, and inside is the optic foramen. It's the little hole in there, optic foramen. The top crack is the superior orbital fissure. The bottom crack is the inferior orbital fissure. And then on the side here is this is the infraorbital foramen. And this is a supraorbital foramen, kind of hard to see though.